getting their fixes from pharmacies and medicine cabinets at home.
Every 19 minutes, a person dies from prescription drugs.
The number of women dying from overdoses in America is skyrocketing.
Hi, my name's Ai Nguyen. I'm a pharmacist at Walgreens. Drug abuse is basically when, a prescription is being used for the wrong indication, or they're using the wrong way, or it's somebody else is using the medication that was meant for another patient. One of the main attractions to abuse drug is prescription drug is that you know what you're getting, and it's safer. The perception that it is safer than street drugs is because you get it from a medical facility or a pharmacy. They know where the medication is coming from, and they know exactly what they're getting, what kind of drugs they're getting. So they think it's safe, but all drugs, if they're being abused, are potentially very dangerous. Like all drugs have side effects and risks associated with it, and if you're not using it appropriately, you get more risk than benefit. And people don't perceive drugs, prescription drugs, as being safe, so they tend to take more of it and abuse it more often just because of the perception. That is a very challenging aspect, because you have patients that actually need it, and then also patients that abuse it. It's hard to figure out who needs it and who doesn't, and how many medications they need it. So it's a fine line that all medical professionals kind of have to use their discretion. They kind of evaluate the patient based on our relationship with them and how well we know them, and it is hard, but we try the best we can to protect the public. Medication being used appropriately by grandparents or parents, but children often can find or get access to this medication. So to prevent it, you can basically keep it in a locked cabinet, or just keep it away from being able easily access to. Like, you don't put it behind just the medicine cabinet in your bathroom or in the kitchen. Just keep it in a safe place. The DEA regulate how much medication, how much controlled medication is being dispensed every year. They have a quota on the number of drugs. So the epidemic of prescription abuse has been pretty bad the last 10 years. What they've done is they've cut down the amount of medication that's available to be dispensed, and there's a limit. They kind of monitor how much each pharmacy or each state or each distributor will sell. So they keep an eye on those. As far as locally, as pharmacists and doctors, just being knowledgeable of a patient and making sure it's being used for the right amount. Usually, prescription drugs, there are I think containers that you can buy and send them back to a drug disposal company, or the Department of Public Health or the police station will take them back at a certain time of the year. You just gotta keep an eye out when they do that. It just depends on which drug that's popular as far as the trends that's out there, but all drugs are harmful. It's just prescription drugs, the perception that it is safe leads people to abuse it more frequently and tend to use it, too much of it. And have you seen in the news that all these celebrities dies from overdosing on prescription drugs? That's just because of the perception that it is safer than the street drugs.